for the past 3 days, and the firemen at the Tema Central Medical Stores have not been able to completely put out the fire at the facility 48 hours after the inferno ravaged the medical stores. Fire officers have engaged the services of excavators to remove the debris and gain access.
For the next 5 days, firemen will depend on the services of excavators to clear the remains of the medical stores.
We have observed that the top debris, a lot of them is plastic, and when they melt, the weather conditions also come in, air is blown into it and it kicks up. So the water that we are splashing on the debris is not getting down. So we have adopted a different strategy. We are inviting some excavators here. They are going to scatter up the debris, and then we'll have access to the seat of the fire.
The fireman said access to water has been a challenge. Medical supplies worth millions of dollars have been burnt to ashes. The surgical, stationery, programs, UNICEF drugstore and World Health Organization departments were all destroyed. Only items at the mechanical department were salvaged. Poor housekeeping has been linked to the fire outbreak. Managers at the medical stores also told TV3 the property was not insured. Neither did they have firefighting equipment. Meanwhile, security and health officials have begun a probe into the cause of the fire.
If we had put some CCTV cameras, if we had fire service personnel here, if we had fire extinguishers here, and a few other things, I think that the damage could have been reduced. I've spoken to the chief fire officer and the police commander in charge of Tema district. I've asked them to come together and put up a comprehensive report by Friday, which will at least give us an idea as to the cause of the fire.
Chairman of the Parliament Select Committee on Health, Joseph Yilechire, said government must launch an emergency call on donor organizations for support.
We should launch a real emergency call for support from many sources, but government has to take the initiative of making sure that we start some program to replace the medicines in particular, particularly those that are vital for various conditions. If we don't do that, we are going to have a backlash on us.
Josephine Frimpong is our correspondent in Tema. She's been following the story since Tuesday when it first broke. She'll be joining me on the phone line. Tell us more about what is currently going on. Josephine, good afternoon.
Good afternoon, Bridget.
All right, for people who are not there, can you paint a picture of what the situation looks like now? And if we have smoke bellowing, how far have firemen gone?
Okay, Bridget. What I can confirm now is that since last night, firemen have been working. That is, they are ensuring that the two excavators cut away the debris so that they can get access to some of the few spots where the fire is still raging. And I also want to add that yesterday, a medical doctor alerted firemen that the protective gloves and dress and nose masks that they are using to fight the fire was not enough due to the chemical that is coming out from the blaze. So what they did was that they had to continue to work, but they had to continue the work, although even though that directive came into place. So that's since last night till now, they have been working. And so far, what they have told me is that looking at the extent of work and what they are doing, by the close of the day, hopefully, they might be able to put out the blaze. And soon after that, national security and BNI will take control. They will take over the whole medical store. They won't allow anyone entry into the medical store so that they will start investigation.
All right. Josephine, I understand they've had to contract the services of people outside the fire service. How far is that going? Why are we not making progress, even with the help of the excavators?
What is happening currently, Bridget, is that the situation is really difficult. The firemen are here all right, and their numbers from, they had a reinforcement from TOR, GPHA, other companies around though. But the main issue is water. That is access to water. The water hydrants surrounding the SMS around here are all dry. So they have to rely on private water operators. And so since yesterday till now, that's what they have been using. They have been buying water from private operators to help them to quench the blaze.
All right. I would imagine, is the place cordoned off?
Not yet, Bridget.
So do you have people standing by?
But by the close of the day, probably the whole place will be cordoned off.
All right. Josephine, thank you very much for joining. I will also try and get to the Deputy Public Relations Officer of the Ghana National Fire Service, Billy Anaglate, to tell us what is making it difficult for them and how they intend to go around even the challenges they have faced. But we'll stay on fire, but from a different community now. And fire swept through a drinking spot and 3 shops at a Shaiman, Lebanon, Tuesday night. This brings to 2 fire incidents reported in the Tema, Shaiman metropolis.
According to an eyewitness, the incident occurred when a generator belonging to a drinking spot exploded. A number of shops were affected. Residents claim the swift response by the firemen saved the situation. Property running into thousands of cedis were destroyed.